Hello everyone, welcome to our channel Medical Mentor. Today I'm going to talk about septic shock. So let's get started. Shock is a life-threatening state in which body is unable to supply enough blood to the tissue, and that leads to inadequate oxygen to the cellular level. There are three general categories of shock. First is cardiogenic shock, in which there is low cardiac output as a result of myocardial pump failure. The second one is hypovolemic shock, in which there is low blood volume itself, and it is due to blood loss or fluid loss. And the third one is septic shock, which we're gonna discuss later. The other types of shock are neurogenic shock and anaphylactic shock, which we are not going to discuss in this lecture. Before starting with septic shock, there are a few terminologies that we need to understand and know their differences. And first one is sepsis. Sepsis is a life-threatening organ dysfunction caused by dysregulated host response to infection. It says that when a person is infected with microorganism, his immune system will try to fight that organism, and when that response affects their tissue itself and cause organ dysfunction, and that is known as sepsis. Second one is septic shock. Septic shock can be considered a subset of sepsis where there is profound circulatory, cellular and metabolic abnormalities along with sepsis. And this septic shock has got greater risk of mortality than sepsis alone. The third one is systemic inflammatory response syndrome, or SIRS. It is a sepsis-like condition where there is systemic inflammation, but the cause can be infectious or non-infectious. Infectious causes are bacterial, viral, fungi or parasite, whereas non-infectious causes are burns, trauma or even surgery can cause SIRS. There are criteria that needs to be fulfilled for SIRS, and the criteria is body temperature more than 38 degrees centigrade or less than 36 degrees centigrade, heart rate more than 90 beats per minute, respiratory rate more than 20 breaths per minute, or arterial partial pressure of carbon dioxide less than 32 mm of Hg. WBC count more than 12,000 per microliters or less than 4,000 per microliters, or more than 10% immature band forms. In the previous literature, presence of SIRS in addition to a documented or presumed sepsis, presumed infection was called sepsis, but now the terminologies have been changed. So now the sepsis is known as dysregulated host immune response to infection that can cause organ damage. Now let's talk in brief about pathogenesis of septic shock. Uh, as we know, sepsis is most frequently triggered by gram-positive bacterial infection, followed by gram-negative bacteria and fungi. Now, in today's time, COVID virus has been an emerging virus causing septic shock. These variety of microbial constituents in the such as endotoxin, staphylococcal enterotoxin B, M protein of streptococci, these microbial constituents are recognized by our innate immune cells such as macrophages, neutrophils, dendritic cells, and even by endothelial cells and complement proteins. And they trigger various inflammatory as well as counter-inflammatory responses. And when these responses go beyond the local area and becomes generalized, then it is known as sepsis. So there are certain factors that are responsible for septic shock, and we're going to discuss one by one each one of them. First factor is inflammatory and counter-inflammatory response, in which innate immune cells such as neutrophils and monocyte, they express a special surface protein known as toll-like receptor, which recognizes special molecule present in the microbes known as pathogen associated molecular patterns. For example, in case of gram-positive bacteria, PAMP is lipoteichoic acid, and in case of gram-negative bacteria, PAMP is lipopolysaccharide. These are recognized by toll-like receptors, and there is activation of transcription factor known as nuclear factor kappa B, and this activation causes increased transcription of genes encoding cytokines such as tumor necrosis factor, interleukin 1, interleukin 12, and high mobility group box 1 protein. Also, increase synthesis of reactive oxygen species and lipid mediators such as prostaglandins and platelet activating factors. Some of the cytokines such as tumor necrosis factor, interleukin 1, interleukin 6 can cause fever. Microbial products also causes activation of complement proteins such as C3A, C5A, and C3B. C5A, as we know, is an anaphylatoxin which causes mast cell activation. C5A is a chemotactic agent which will recruit or attract neutrophils or inflammatory cells and increases cytokine production. Similarly, C3B is an opsonin which will uh, tag microbial organism and recruit monocyte for phagocytosis. These all factors result in pro-inflammatory state. This hyperinflammatory state can trigger counter-regulatory immunosuppressive mechanisms through interleukin 1 receptor antagonist and interleukin 10, which is also known as anti-inflammatory cytokine. And so because of this, septic patient may oscillate between hyperinflammatory and immunosuppressed state. Second factor is endothelial cell activation. These pro-inflammatory state will increase the expression of adhesion molecule on the endothelial cell, which will further increase cytokine production. Also, these cytokine will now damage the tight junction between endothelial cell, which results in vascular leakage and edema, which further leads to impaired tissue perfusion and can result in organ dysfunction. Similarly, these activated endothelial cell causes increased production of nitric oxide, which will cause vascular smooth muscle relaxation and result in hypotension, which further can result in organ dysfunction. Third factor is procoagulant state. So microbial products can activate coagulation through activation of factor 12 directly. Pro-inflammatory cytokines triggers monocyte and endothelial cell to secrete tissue factor. On the other hand, pro-inflammatory cytokines also inhibit production of anticoagulant factors from endothelial cells such as tissue factor pathway inhibitor, thrombomodulin, and protein C. In normal process of coagulation, the final product is fibrin, in which during the process of fibrinolysis is broken down into fibrin degradation product. But these pro-inflammatory cytokines, it will increase the expression of a molecule from endothelial cells known as plasminogen activator inhibitor 1, which will dampen fibrinolysis. As we have already discussed, endothelial cell activation can result in vascular leakage and edema, and this results in decrease in blood flow at the level of small vessels, which results in stasis of blood in those vessels, which results in diminished washout of activated coagulation factors, which further results in systemic activation of thrombin and deposition of fibrin-rich thrombi in those small vessels. And if that occurs throughout the body, that results in disseminated intravascular coagulation. Fourth factor is metabolic abnormalities. These pro-inflammatory cytokines, such as tumor necrosis factor, interleukin 1, as well as certain stress-induced hormones such as glucagon, growth hormone, and glucocorticoids, these can suppress insulin release, as well as these promote insulin resistance and increases gluconeogenesis uh, in the liver, causing hyperglycemia. The fifth factor is organ dysfunction. All those points that we discussed earlier, such as pro-inflammatory state resulting in endothelial cell activation, which further increases vascular leakage and edema, which results in impaired tissue perfusions, and vascular smooth muscle relaxation, which results in systemic hypotension and microvascular thrombosis. These all decreases delivery of oxygen and nutrients in the cellular level, causing cellular hypoxia, which ultimately may result in multi-organ failure. There are three stages of shock. First is initial non-progressive stage, in which our reflex compensatory mechanisms are activated and they can compensate for the shock, and vital organ perfusion is well maintained over here. Second is progressive stage in which there is tissue hypoperfusion and there is onset of some worsening circulatory and metabolic derangement such as metabolic acidosis, but still we can improve this condition through fast treatment. And the third is irreversible state, where there is severe cellular and tissue injury, and even if we treat this hemodynamic defect, the severity of cellular and tissue injury is so severe that survival is not possible. There is one syndrome which is similar to septic shock, known as toxic shock syndrome, in which super antigens such as toxins from Staph aureus are known as super antigens because they activate many polyclonal T lymphocytes. And when these polyclonal T lymphocytes are activated, they release high amount of cytokines, which result in vasodilation, hypotension, shock, and even result in patient's death. This concludes today's lecture on septic shock. Thank you for listening. Please share and subscribe to our channel Medico Mentor and help us grow.